In this video, we will simulate procedure for a potential COVID patient in the EBNHC ILI Clinic from rooming the patient leaving the clinic. This video will include exchanging swabs between healthcare workers, cleaning and preparing the room, and what to do before an exam with a patient in severe respiratory distress. After being processed in triage, the MA will escort the patient to an open room, clipping 4 labels to the door and rooming the patient. The provider then moves the patient into their schedule and enters room 301 to don full PPE. For a full demonstration on how to don and remove PPE as well as procedures for triaging patients, please see the previous video, PPE Demonstration Procedures in Pediatric ILI Clinic.
Hi, I'm Dr. Hunter. How are you?
Good, how are you?
Good. Can you confirm your birth date for me, Mrs. Tess?
January 1st, 2004.
And what's your last name?
Joe?
Okay. And what are you here for today?
The provider then begins the exam with the patient, determining what tests need to be done, mainly by the history.
About 3 days.
Anybody else at home sick?
My grandmother, my mom, my dad, everybody's kind of sick.
And anybody at home who's got COVID?
My grandmother does.
Having any trouble breathing?
No, currently.
Okay. And do you have any health problems, any allergies?
No.
Taking any medications?
No.
Okay. Did you take anything for the fever?
I took Tylenol this morning.
Oh. Did you take your temperature?
I did not. I just felt really hot and had the chills.
Okay. So we're going to do some testing. Since you have the sore throat, I'm going to test you for strep.
The provider picks out the swabs necessary for the exam with clean hands as they have not touched the patient yet, and places them on the exam table. The provider then physically examines the patient.
Deep breath. Okay. So do the strep test. Open your mouth, stick out your tongue, say ah. Okay. And we're going to do the COVID test.
The provider will then carefully place the swabs in the specimen bags on top of the cart without touching the clean area. The provider then calls the nurse's station for the RN or MA to pick up the specimen, specifying what tests have been taken.
Hi, this is Lucia.
Hi, it's Dr. Hunter. I have some specimens in this room.
Okay, what specimens do you have? COVID and strep, is that correct? Okay, be right there.
Thank you.
The provider will then hand the specimen bag to the RN or MA.
Antonia, can you please run the strep?
If one of the tests is COVID, the RN or MA will bring the specimen to phlebotomy wearing full or minimal PPE. Once dropped off, the RN or MA sanitizes the PPE and disposes of the gloves. To reduce patient interaction between departments, employees should bring down any swabs the patient may have.
Hi, Ms. Test is done. If you could just print off her after visit summary for her, please.
When the exam is complete, the provider will call the nurse's station to print the AVS. Then the RN or MA will hand the printed AVS to the patient as they leave.
Hi, your ABS. Can I have your name and date of birth?
Jane Doe, January 1st, 2004.
Okay, thank you. Please hold me that down.
If there are enough wipes, the provider will then wipe off their PPE and stethoscope in the room. If there are not enough wipes, the provider will wipe off in room 301. Once ready, the provider will turn the sign from the green go to the red stop, indicating that it is ready to be cleaned. Once the visit is complete and the room is cleared of the patient and provider, the RN or MA will enter the room in minimal PPE to clean the room. First, replace any needed items on top of the clean cart from the top drawer. The top of the cart consists of 1 NP swab, 1 flu swab, 1 throat swab for strep, 1 paper wrap tongue depressor, and 2 propped open specimen bags for no-touch drop-in of specimens. Then the RN or MA will wipe down the table, otoscope, desktop, keyboard, mouse, stool, chair, and doorknob, and is now dirty. They will also wipe down the thermometer and pulse ox if vitals were taken by the provider in the room. Lastly, the sink is wiped off and the RN or MA cleans their PPE. With cleaned hands, they place the now clean cups back on the clean area on top of the cart, and the vital sign equipment is brought back to the medication room. The sign is then turned from red to green, indicating it has been cleaned and is ready to be used. In a case where the triage nurse determines the patient is in severe respiratory distress, the patient is immediately roomed, and the provider places labels, pulse ox, and temporal thermometer on the clean area on top of the cart. The provider will then take vitals, oxygen, respiratory rate, pulse, and temperature, and once the vital signs have been obtained, the equipment is placed on the dirty sink area. Then the provider begins the exam.